A healthy balance of bone and muscle are crucial for the body to function properly. Now imagine if your muscles, which are used to move, turn into bone. Once upon a time, in the fine city of Philadelphia, a boy with very odd big toes was born. His name was Harry Raymond Eastlack Jr. When Harry was 4 years old, he broke his left leg, or more scientifically speaking, his femur. By the time he was released from the hospital though, an extra bone had grown in his leg, creating a bulge where his femur had initially been broken. This severely hampered his movement, causing a permanent limp. Before we continue this case study, do you think he should get surgery to remove the new bone growths that are out of place? He underwent 11 surgeries to remove excess bone growth, a fatal error. This greatly accelerated the progression of his disorder, and only a year later, in 1938, Harry was officially diagnosed with Mitosis Ossificans Progressiva. His joints and spine began to fuse, and by 1946, he was permanently angled and was later admitted to a long-term care facility where he was permanently bedridden. In 1973, Harry unfortunately died of pneumonia, just a few days away from his 40th birthday.
So, besides the multiple surgeries performed, which made this rare condition worse, doctors ordered biopsies while trying to diagnose him. Biopsies are usually just a simple collection of some of the patient's tissues for the purpose of laboratory analysis. In modern medical terms, this would be a core or incisional biopsy, as the doctors only intended on collecting small tissue samples from the affected areas. Unfortunately, however, these biopsies actually increase the severity and accelerate the progression of the disorder, which we know today as Fibrodysplasia Ossificans Progressiva. First documented in 1692 and known for much of its history as Stone Man syndrome, FOP is a rare and complex disorder. More detailed writings did not emerge until 1742, but the rarity of the disorder made it difficult for scientists to gather information about it. In fact, in the 1900s, the disorder was originally given the scientific name Myositis Ossificans Progressiva, which we now know to be inaccurate, as not only muscles, as is indicated by myositis, are affected. This was later changed in the 1970s by Dr. Victor McCusick, the father of medical genetics, to its current name of FOP. Most research conducted in the 1990s and 2000s was conducted by the FOP Research Group at the University of Pennsylvania, headed by Drs. Frederick Kaplan and Michael Zasloff.
So, what are the symptoms? In this rare genetic disorder, bones spontaneously start to replace other bodily tissues, getting worse and worse over time. Those born with this disease all have a signature deformed big toe. As they get older, during the first 10 years of their life, they begin to experience random flare-ups where their soft tissues randomly turn into bone. But what are soft tissues? If you said ligaments, tendons, or skeletal muscle, you're right. Soft tissues can include ligaments, which connect bone to bone, tendons, which connect muscles to bone, and skeletal muscles, including your abs, shoulders, quadriceps, and hamstrings, which help you move. It's important to note that not all muscles are affected. This includes the heart muscles, the diaphragm, and the tongue. Patients will often experience difficulty hearing, a locked jaw, thumb malformations, and a reduced ability to move. The majority of people with Fibrodysplasia Ossificans Progressiva can no longer walk after the age of 30 and have to use a wheelchair for the remainder of their life, which is not very long. The average lifespan of someone with Fibrodysplasia Ossificans Progressiva is around 40 years old. A rather morbid question they will face as they get older is what pose they will have to hold for the rest of their lives, as they will soon be unable to move like a stone statue.
But what causes this scary disease? Although the exact cause of FOP is still being researched, a common mutation or change in the gene that is involved in our bone-building pathway is observed in all cases. This gene is called the ACVR1 gene. There are proteins that bind to the ACVR1 gene to temporarily turn off our bone-building pathway, so we only grow bones where we need them. Genes with the mutation do not allow the protein to bind to them, so they stay on forever and keep producing bones even in places where bones should not be. This can eventually result in a fatal condition known as thoracic insufficiency syndrome, which is when bone grows between the ribs, causing the rib cage to become deformed, making it difficult for the patient to breathe. But don't worry too much, this is an extremely rare disorder. So rare, in fact, that statistically only 0.61 people in a million end up developing it. Since Fibrodysplasia Ossificans Progressiva is a rare disease, research is still being done to figure out what it is, how to know if someone has it, and how we can treat it. Current research has been focusing on developing drug treatments to help cure this disease. Currently, 3 different drugs named palovarotene, garadosmab, and saracatinib are undergoing further research, including clinical trials, which is when a drug is administered to patients to test its effectiveness. Future plans for fibrodysplasia consist of developing an effective pathway to diagnosis that reduces the time taken to diagnose an FOP patient, as well as provide them with direct access to expert clinical guidance and treatment. More clinical research, including drug screenings and non-invasive treatment plans, are developing as they can provide further evidence of the mechanism and genetics behind Fibrodysplasia Ossificans Progressiva. Thank you for watching. We hope that this video gave you a better understanding of what Fibrodysplasia Ossificans Progressiva is, as well as the importance of future research in this disease in hopes to develop a cure.